My name's Max Kindred, and I'm here to talk about the Net Zero Food Programme. I'm going to give you an update about what we're doing. Given the stream that this presentation's on, I'm going to be, have some focus on waste, but also going to talk about net zero food overall. The NHS has some ambitious targets to reach net zero, and so this presentation is going to talk about how do we get there for food and food preparation. We're aiming to hit an 80% reduction in carbon by 2036 to 2039. So that's a steep way to go in 10 years. And so what does the national picture show, and what steps are hospitals taking already to get there? And so this is the carbon footprint of the NHS. This is a slight variation on the one in the net zero report because I've actually put food in there. So food is 6% of the NHS carbon footprint. And that's slightly more than waste, sorry Liam, and also almost as much as all the energy we use in buildings. So we use a lot of carbon to purchase food in the NHS. And so there are two main actions that we try to do to reduce carbon in food, right? And one of them is pretty clear, right? Minimizing the waste. And the second one is about increasing the number of healthy and lower carbon meals. And so what does that actually mean in practice, right? For food waste, one of the key things is to measure it, right? If you're not measuring food waste, you're going to really struggle to make the plans and the reduction plans and make the savings and work out if you've actually made a difference by making some changes. The second one we see, which is really clear, and I'll go into that in more detail throughout the presentation, is getting control of your meal ordering and being flexible about it. So control and flexible are quite a slightly different things, but having both of those things means that your food waste generally is much lower. And then serving the right amount of food at the right time in a way that is appetizing, right? And those kind of three things we'll talk about a bit later. And then targeting the right interventions, right? You should see, depending on what kind of food you serve, you should be able to have a different type of waste profile, and then you need to make the right interventions for that type of waste that you're generating. And then for healthy and lower carbon meals, right? Healthier meals means processed meat. That's pretty clear from the British Dietetic Association that processed meat is a no-go really, and we should be trying to slowly withdraw that from patient menus and then on to staff and visitor menus if possible. But it's still there around the country, but it's something that we try and recommend to get rid of. And then blending in low carbon ingredients that are healthier, more fibrous into high carbon dishes. And then trying to follow the BDA guidance on menu design, talking about the different blends of dishes that you should have, generally ends up with a lower than average carbon footprint for an NHS menu. And then we're going to flash up some nudges later on, and you can let us know, how many of those you're doing and how successful they are, because there's some really good scientific evidence that those nudges, in the right way, can really help, make a reduction in the carbon of the food that you're serving. So starting with the food waste, right? This is RAP this year, but referencing data from previous years, so it's not as up to date as we'd like. We're trying to get them to update that, but the amount of food waste generated in hospitality and hospitals is included in that is 18% of the food purchased, right? So if you were to know the cost of food that you were purchasing and take 18% of that, that's what we estimate you're throwing away as a number. It's a cost, right? So it's quite significant, right? And I don't know how that relates to some of the other areas of waste, right? But that's probably up there, right? In terms of a percentage of waste that we have in the NHS versus how much we purchase. So what do I know, right? So I'm the national Net Zero Insight Manager, right? So my job is to understand the data and what it means and help to give it back to you guys and give it back to the national team to help drive policy, help drive changes at trust level. This graph might seem super obvious, right? But it's there, right? The more unserved meals you have, the more food waste you generate. And I could see someone in the room where it wasn't the case at their hospital, right? There was something else was happening at their hospital where the more unserved meals they had, their food waste didn't go up, right? And that was because maybe a staff member might be having a lunch, or it might go in the fridge for later on. So this relationship doesn't always exist, but in general, right, if your number of unserved meals go up, your food waste goes up. Pretty obvious. And it goes up by about 200 grams, which is a small meal. If you're in an acute setting, depending, if you've got that meal control and flexibility in your meal ordering, you should get more plate waste than unserved meal waste. If you're in an acute setting and you've got more unserved meal waste, that suggests that your ordering needs to be looked at. And then if you're in mental health, you should get more unserved, right? And then community sits somewhere in the middle. In general, though, I mean, these graphs are about the ratio, but per patient, we see the same amount of food waste across all settings in the NHS. There's no significant difference. The total food waste per patient in acute versus mental health, so far that we've seen, is the same. It's just the different types of food waste that you get. And then one of the key drivers for that meal ordering control, we believe, is to get electronic meal ordering in place. Now, this graph's a little bit complicated, but essentially along the bottom there, you've got how far in advance people are ordering, and then on the left-hand side, you've got what percentage of meals in the NHS are ordered that far by EMO that far in advance, right? And so as you get closer and closer to the service, more and more of the meals are being ordered by EMO, right? And so if you're ordering closer to the service, you're much more likely to give the patient what they want, right? They're more likely to know what their appetite is, how sick they are, what medication they're on, if they're about to go for surgery, if they're about, the closer you get, the more likely you are to get the right food to the right patient at the right time. And so we think EMO really has a link to food waste. And just to back that up, I don't know if anybody you've had an electronic meal ordering company come and try and sell you their services. I don't think any of them are showing this graph or this number at the moment, but they should be. Currently, sites with EMO fully implemented in the NHS generate, on average, 20% less food waste. And that works across all the settings so far that we've seen the data for. And the trend probably will continue this year. This is last year's data, but this year's data probably will show the same thing. So, we did it, 18% of your food waste budget might be going in the bin. If you reduce that by 20%, you've got a significant saving. You probably pay for the EMO service within a year at best, right? So shouldn't meet any of those kind of requirements for return on investment in the NHS. So really recommend exploring that if you haven't already. And then here's the bit about the presentation, right? This is, we've done lots of trials now in different settings where we've taken away the grey and blue and scratched NHS plate and given them restaurant quality blue plates and bowls. And you get, on average, 15% less plate waste and 15 to 20% more empty plates, right? So 20% more people are eating everything that is being served to them, right? And that's, as a dietitian, the dietitian expects the patient to eat everything that they serve to get all the nutrients that they've planned for them to eat. And often that's not the case. But here, when you give them food in a blue crockery restaurant quality plate, then you get that. We've seen people try and just put a blue plate on, plastic melamine, no difference, right? It's about getting the thing with this is it makes the food look good, right? And it helps dementia patients see the food because blue is the last colour to go for the dementia patients. But not only that, right? Staff want to serve that, right? Staff are proud to serve that food. They take more care. They explain the food better. People feel like they're getting a better food service, and staff feel like they're giving a better food service at the same time. So we've done trials at, I don't have the number in front of me, 20 trusts now. Almost all of them see the improvement. That one there, right? That bowl is quite large, right? So if you don't have good control of your portion sizes, we've seen food waste go up sometimes, right? So it's really important you have control of your serving size that your staff give out. That's the only time we've seen food waste go up when we've gone to these blue plates, is when they're just shoving loads more food on it because the plate is bigger, and then food waste goes up. Otherwise, on average, even including those places, food waste is down, plate waste is down 15% in those places. So here's some examples of things that are happening around food waste. I've got one or maybe two. I haven't named them, but this hospital, reasonably close to here, essentially had no control over their meal ordering, which is why I haven't named them. Right? It was pretty shocking before, but they put in EMO. They got down that kind of culture of ordering meals just in case, 5 or 10 extra, sending up meals by guessing. They got rid of that, and their food waste per month dropped from almost 10 tons to 3 tons. And I think now this is last year or year before, they're now down under 2 tons, right? And that's just from getting that ordering bit right. They haven't changed the food, they haven't changed the menu, they haven't changed their processes apart from that ordering bit, right? And they were sending up the right number of meals to the ward. Okay, that was my main food waste case study. We'll probably touch on some more in a minute. Low carbon meals, right? What I'm showing here is on the right hand side is a screenshot of the Great Food, Good Health platform, which is going to be talked about quite a lot upstairs today at the Healthcare Catering Live conference. This has been going for a year and a half. It's a brilliant resource for trusts to go and find recipes that should be able to be used. They're designed to be used in a healthcare setting, right? They've got the right serving size. They meet the BDA requirements. They should meet all the requirements for sale in retail as well. And you can see on the right hand side, right, these are all chilies, right? We've got lots of different versions of recipes that you can swap out, pretty simply for a recipe you already have, if you want to. You can design your own menu based on that. We've had some examples I'll go into later have taken multiple dishes, but some have just taken one. It's available to all, and there's over 200 recipes on there, and they're all kind of carbon rated. You might be able to just see there's a carbon rating on the bottom of each of those recipes saying whether it's an A, B, C, D, or E. And we've got most of the recipes on there being medium or low carbon on there. And as the National Insight Manager, I know this, right? This is a graph that shows the total weight that the NHS buys from NHS supply chain of things in different categories, and the total carbon footprint of those things that we're buying on the left-hand side, right? And so we buy a lot of milk, right? Milk sits way over there all by itself. But then you can see some of the other things that maybe have a higher carbon factor, right? So butter, spreads and fats and beef, you can see that we don't buy that much, but the carbon factor on those is really high. We buy a lot of cold beverages, so that's, teas, juices, milks, water, cans of stuff for retail. And then we've got, ready meals, right? So plated and multi-portions are the kind of ready meals that we buy. And so if you're ready to make low carbon changes to your food offering and you buy from supply chain, I can give you this for your trust, right? And so I've done that with 3 trusts so far, and it's been really quite a powerful tool to help trusts to start that process of what interventions they can make. What have we got next? And so, we've put some of the simplest interventions onto the net zero food, what's called product intervention calculator, and these are some of the interventions that we're recommending, and people can pick and choose which one they can make. We recommend that through that process I was talking about of interacting with you, but we've also got a calculator online that you can go and check for yourselves with your procurement teams. If I buy 100 kilos of beef rump a month, and I was to move that to some of that's turkey breast, or move some of the beef mince over to lentils, what kind of carbon saving would I make? But also for most of these, what kind of cost saving would I make? Right, and so there is, in most of these things in net zero food, about lower carbon, healthier, more nutritious meals, there's a cost saving as well as a carbon saving. So, case studies now, and my apologies for the picture. I didn't have a good picture. That was annoying. University Hospitals, Morecambe Bay, in the northwest. I showed them that graph. I showed them the potential interventions they could make. They went away and they changed their retail menu first, trialed it in retail, 3 or 4 months in retail, checking out the recipes work, checking the chefs could make it, checking that the staff liked it, and that the staff could talk about it really positively with the patients when it went to patients, and then it went to patients. They reduced their carbon across the whole trust by 18% and reduced their costs across the whole trust for food by 10%. Right, and that's looking just at the menu, right? They still serve a lot of milk and snacks and vending and all that kind of stuff, right? They haven't touched any of that other bits. They've just done the menu, and they've made a significant reduction for them. And they're using that to reinvest in, I think they're going for blue plates. So they're reinvesting some of that saving in their food service. And this is our first one. This was a small community hospital in London. And they've gone for some of the nudges, which I'm going to talk to on the next slide, as well as using lots of the recipes from the recipe bank and following the BDA Digest guidelines for different types of protein and dishes that you would serve across the week. And so they did 18% reduction in carbon, but at the same time they got their portions under control. They realised they were serving much too large portions, and so they also reduced their food waste by 30% at the same time. And you can see there, right, what they've done is they've introduced a vegetable soup as standard across the top of the menu, right? And I'm not saying that's something that everybody should do, but they managed to replace a lot of their calories from the mains through the soup. And then they have a vegetarian main on the menu every day above the main meat dish. And that's kind of some of the nudges that you might want to implement as ways to encourage lower carbon meals, right? This is pulled off the website of Garena by Default, who are an organisation that if they contact you, we recommend working with them. They help you to implement some of these things for free in your hospital service. And essentially, some of the stuff that they do, right, is that top one is the only one we have an issue with, but they've told us they're not going to try and do that top one in NHS sites necessarily. But all the other ones we agree with, right? If you have one vegetarian or vegan option on the menu every day, and the person doesn't like that, then they won't have it, right? But if you've got two, they have more. There's challenges around that for sure, but the increasing the number of plant-based options generally increases the amount that get uptaken. So I've seen some really good examples recently of that third one, where in your retail setting, the order in which you have the dishes as you go around your retail setting really has a big effect, right? So if you have the salad bar first, rather than last, the uptake of the salad bar goes through the roof, right? If you have the vegetarian or the vegan option, or if you want to, the option you make the most money on first, then that uptake goes up as they have to walk around longer and longer to get to the back of the retail buffet. Items listed first or last get ordered more often, right? So, not having the beef lasagna first on the menu, but having it somewhere in the middle definitely, again, makes changes. And then naming stuff better and emphasising the kind of benefits of it rather than just calling it vegan dish. So yeah, have a look at those. Definitely recommend doing at least some of those on your menu. And some of the stuff there is actually quite simple to implement. And so, the program itself that we operate really is trying to operate with sustainability at its heart, but we want to bring in all walks of life. We want to integrate our program with social care. We've got children's meals in the top list with Charlotte Farrell, who I think is speaking upstairs today. We've got dietetics. We've got meals for people who have struggle swallowing, so ITSY meals. We also really working hard to improve in the NHS, because often those are the meals that come up on Facebook saying, what is this that got served to my grandparent in hospital? And so we operate, these pictures are from the NHS Chef Competition, which is about to enter its 5th year and is running next month. And so throughout the whole competition, sustainability is a really core part of the requirements that chefs have to deliver. And so we're really seeing these competitions upskill chefs in the NHS to deliver more sustainable food. So these are the winners last year. This is Alexandra and Manuela from Royal Surrey. And you can see that they had a really, really nice lentil patty dish on their menu through that. And they've had both this gnocchi dish, which is a really low carbon fish dish, and a lentil cottage pie dish included now on Compass and Medirest menus around the country. And we're hoping that it will be on the recipe bank that I showed earlier in a minute. And so, throughout the competition, they really have to deliver some really, really key sustainable improvements as they go along. So, yeah, if you want to have a look at some of those recipes, it is the barcode on the left-hand side. If you want to access the calculator that allows you to see which kind of swaps you could implement at your site and what the kind of cost and carbon benefits of those would be, you can try the middle barcode. That is for NHS only. And then the same on the right-hand side for NHS staff only. There is the guidance that is currently in draft form, and NHS England bureaucracy means that it's been in draft form for a while. The guidance of how to measure food waste and what kind of changes you could implement to reduce food waste based on the type of food waste that you have, right? So you measure the food waste, you go, I've got this kind of food waste, and then you make the kind of changes recommended in that document. So you can scan that. If you can't get access to that food waste guidance, you can email the email address on the right-hand side to get access, and they should give that to you. And so you can see that guidance, and that guidance is going through publication and hopefully soon will be available. And I think that's me.